anything is below 40, it is a last ditch from a person to save from the death of the individual, and working range would be 15 to 50 mm of Hg. 90% of the fall can be corrected from Cushing reflex or CNS ischemic response. Both are same. Cushing reflex or CNS ischemic response. Okay, if the BP is less than 40, come on, what is happening, ma? Yes, no blood flow to the brain. Appademautundi ischemia, then stimulation of vasomotor center, stimulation of sympathetic innervation, increased sympathetic tone, blood vessel, vasoconstriction, increasing. This is how you should present in the exam with the flow charts. And not only flow charts are enough, you should also self-explanation is also needed. Depending upon the mark, 6 mark, draw the flow chart and explain it. Okay, only 3 mark, flow chart is enough. Like that. Okay, so the another mechanism is already short acting is over. Second mechanism is what? Intermediate acting regulatory mechanism. What is the name of the method, Nana? Control of BP by altering the blood volume. Name of the method, please. Capillary fluid shift mechanism. Am I right? This is a capillary. Capillary will have many pressures: hydrostatic pressure, colloidal osmotic pressure, hydrostatic pressure. Even interstitium also will have hydrostatic pressure, interstitial pressure, all pressure. Due to the changes in these pressures and the arrow, down arrow, up arrow indicating direction of the movement of the fluid. So when the blood pressure is more fluid is filtering through the capillary into the interstitial spaces, so that blood volume decreases, resulting in decreased BP. Reverse changes will taking place if the BP falls. That's all. More blood volume, more loss of the blood into the interstitial fluid. Less blood volume, more blood is added to the capillary in a reverse manner. This mechanism is known as, what is that? Capillary fluid shift mechanism. What is that mechanism? Comes under what category, Nana? Very good. Intermediate acting regulatory mechanism. See, BP, increased BP, decreased BP. In increased BP, what is happening, Nana? Hydrostatic pressure, increased capillary hydrostatic pressure, so fluid loss into the interstitium, decreases the BP. And here, when the BP is less, decrease in the hydrostatic pressure, fluid is taken in, BP increases. What is the normal hydrostatic pressure of the capillary? Is the question. Enta? Find out and tell me. Find out and tell me. What is the normal colloidal osmotic pressure of the capillary? Very good. Who is that? Very good, Nana. 25 mm of Hg. MCQ question. Very good. I don't know who said. Very good. Very good, beta. Arey, baat kar rahi. Started talking. Acha ho. Very good. Very good. Right. Next one. Next mechanism is what? Stress relaxation mechanism and reverse stress relaxation. Stress relaxation means what, Anna? Smooth muscle is stretched for a long time. It undergoes relaxation. Where is this smooth muscle is present? Underlying the blood vessel. Very good. Underlying the blood vessel. If the BP is more blood vessel is stretched for longer time, causing stretch relaxation, increasing the capacity, blood gets pooled, and this causes effective blood volume, and effective blood volume decreases, thereby BP decreases. Reverse changes are taking place in a reverse manner. If the BP is less, blood vessels are not stretched, no stress relaxation, decreased capacity, blood is not getting pooled, no effective blood volume, BP increases. These are the reverse changes. This mechanism is known as stress relaxation of the vasculature, and reverse changes is known as reverse stretch relaxation. The reverse mechanism is called reverse stretch mechanism. Okay, so now coming to long-term regulation of the blood pressure. What is the long-term regulation of blood pressure is done under? What? How many headings, ma? What is that? Renal body fluid mechanism, renin-angiotensin mechanism, hormones like aldosterone and ADH. What is the full form of ADH? Other name of the ADH? Vasopressin. Very good. So examiner will ask you, BP is controlled by long-term mechanism. Please tell. Means you have to tell these 3 methods. Out of that, the first method is what? Renal body fluid mechanism. We'll see the renal body fluid mechanism. Suppose BP is increased. How the renal system bring the BP back to normal? Increase the renal blood flow, increase the GFR, increase the urine formation, decrease in ECF volume, decrease in the blood pressure. BP restored back to normal. That's all. Very simple. And this side, decreased BP, reverse changes. Decrease in renal blood flow, decrease in GFR, decrease in urine formation, increase in ECF volume, increase in the blood pressure, restoration of the blood pressure. What is the normal renal blood flow? And the GFR value you are saying. 125 ml is GFR value. 1200 ml is the normal renal blood flow. So this is how your renal body fluid mechanism is involved in the long-term regulation of the blood pressure. It may take many days also, okay, to hold the BP long-term, and these mechanisms are very, very essential. Now coming to renin-angiotensin mechanism, very, very, very famous, frequently asking, Viva, multiple choice, 3 mark, 5 mark, everywhere it is asked. Renal angiotensin mechanism. Not renal, sorry, renin-angiotensin mechanism. The BP is less, decrease in renal blood flow, decreased GFR. GFR is decreases renal ischemia or decreased sodium chloride level at the macula. Release of renin from juxtaglomerular cells of the kidney. If you want to know all the structures, you have to go for kidney lesson actually. By this time, only remember the terminology. Sodium chloride is detected by macula cells, macula densa. Where are they located? Macula densa, distal convoluted tubule which passes through the Bowman capsule. There the macula cells which detect the level of the sodium chloride level. Okay. Now, and that converting angiotensinogen to angiotensin 1 and angiotensin 1 to angiotensin 2, angiotensin 2 to angiotensin 3. Sorry. And the actions of angiotensin 2 and 3 are, it causes vasoconstriction, directly increases blood pressure. It also, these two, increases reabsorption of sodium chloride from the diet, increases ECF volume, increases blood volume, thereby increases blood pressure. And aldosterone secretion, reabsorption of the sodium chloride, aldosterone secreted from the adrenal gland. And once the reabsorption of the sodium chloride occurring and increases the level of ECF volume, increase in the blood volume, increase in the blood pressure. ADH secretion, can you tell from where the ADH is secreted? Very good, very good. Posterior pituitary gland. So reabsorption of the water, very taxed from by releasing from posterior pituitary. It is released from posterior pituitary, acting on distal convoluted tubule for the reabsorption of the water. So, and once the reabsorption of the water is there, increase ECF volume, increase blood volume, increase the blood pressure. Blood volume is more, blood pressure is more. This is how the renin-angiotensin system is involved in the controlling of the blood pressure by angiotensin 2 and angiotensin 2 and angiotensin 3. You have to write entire this thing and you should explain. Self-explanation is mandatory. Flowchart physiology is nothing but flowchart and self-explanation. So same thing, long-term regulatory mechanism. In below, all the long-term mechanisms are involved. This is angiotensin 1, angiotensin 2, and this is formed from renin, and it is a renin-angiotensin system. They explained in under two headings called direct mechanism and indirect mechanism. Okay, so direct mechanism, this is indirect mechanism by aldosterone system, renin-angiotensin system, but the final action is same, and the functions of angiotensin 2 and angiotensin 3 will produce the same effects and bringing the BP back to normal. Okay, so this is the diagram, and already I told you. So this is the glomerular apparatus, the JGA apparatus, from where juxtaglomerular cells, renin is secreted, increased renal arterial pressure, decreased change in the renal nerve, causing renin causing converting angiotensinogen from lungs, converting into angiotensin 1, and angiotensin converting enzyme converting it to 2, acting on adrenal cortex, secreting aldosterone, decreased sodium and excretion, that increased extracellular fluid volume. Once the extracellular fluid volume is more, and the BP is also more. Okay, so this is how. Finally, some hormones are involved. What is the first hormone? What are catecholamines? Dopamine, adrenaline, noradrenaline, all together called catecholamines. Hormones released from the medulla are called catecholamines. They release catecholamines causing vasoconstriction, increase cardiac output. Cardiac output is more, your BP is more. ADH, large amounts, vasoconstriction. The name itself telling. ADH, other name is called vasoconstrictor, increasing the blood pressure. Glucocorticoids, from where are they secreted? Cortisol, corticosterone, and these are sensitize vascular smooth muscle to the action of the catecholamine. This action is called permissive action. What is the meaning of the permissive action? Permissive action. Permissive action means what? What is the meaning of the permissive action? Cortisol, corticosterone sensitize the vascular smooth muscle to the action of the catecholamine. cortisol, corticosterone, these are needed sensitizing the vascular smooth muscle of the action of catecholamine by the glucocorticoids. That action is called permissive action. Permissive action ante it is, one action to execute one action, another hormone or another gland is helping, is known as permissive action. Okay. Nitric oxide, from where it is secreted? By endothelium derived relaxing factor, and endothelium of the blood vessel acts locally, causing vasodilatation. Aldosterone, already I told you. What is aldosterone action, ma'am? Aldosterone action is what? Adrenal cortex in response to decrease in ECF volume, increasing the reabsorption of sodium chloride from the kidney tubule, causing increase in ECF volume. Once ECF volume is more, your blood pressure is more. Other hormones like ANP, atrial natriuretic peptide, secreted from atrial myocardium in response to increased ECF volume. Increased ECF volume facilitating what? Sodium chloride water excretion into the urine. That decreases ECF volume, thereby your blood pressure. So many hormones are involved in the controlling of the blood pressure, but not effectively. But anyways, they controlling the BP. Like catecholamine, ADH, glucocorticoids, nitric oxide, aldosterone, ANP are the hormones involved in the blood pressure. Finally, applied aspect. If the BP is more than the normal, what do you call the condition? Hypertension. In adults, the hypertension value would be 140, more than 140 to 90. There are two types of hypertensions are there. Primary, 90% will suffer from primary. Secondary, only 10%. In the primary, the cause is not known. It is hereditary. From one generation to other generation, we get the BP without any reason, is primary. But 90% BP patients are primary only. They can't, it is helpless, not in their hands. But it can be controlled by lifestyle modification and all. Okay, so secondary hypertension, the remaining 10% by renal hypertension. Any endocrine gland is involved if they causes hypertension, like hyperthyroidism, Cushing's syndrome, also causing the hypertension. And renal hypertension, stenosis of renal artery, glomerular nephritis. What is the meaning of stenosis? Narrowing of the renal artery. These all are secondary hypertension. Treatment would be diuretics, calcium channel blocker, ACE blocker, beta blockers are to be given for the treating of the patient. Hypo means below 90 to 160 mm of Hg. Primary is there, secondary is there. Primary is idiopathic. The cause is not known. Any cause is not known is what? Idiopathic. Secondary hypotension is due to hemorrhage, MI, myocardial infarction, heart failure, hypothyroidism. These are the causes which causing the secondary hypotension. Just they lie down on the floor if they suffer from the secondary hypotension. So with this, and I concluded the blood pressure. Remember one thing, blood pressure till now, what I have explained is theory part completely. Okay, in exam, what comes, we are writing. Where is the practical part? In the cardiovascular examination, we teach you practical part in detail.